Welcome to the 21st Century Man podcast. We're doing our deep dive series, going chapter by chapter through the book, The 21st Century Man, and pulling out the key stuff for you.
That's the plan.
So today we're getting into chapter 57, Plastic Surgery for Men. We're drawing heavily on the insights from Dr. Eric Mariotti's contribution here.
A really informative chapter.
Yeah, and our mission really is to unpack the main facts, the actionable takeaways, so you can get a clear idea of what plastic surgery options are actually out there for men nowadays.
It's definitely a topic more men are considering. As we get into middle age, things change. Life often gets more hectic. Maybe stress piles up.
Less time for the gym, maybe.
Exactly. Less time, sometimes less motivation too. And you start seeing those physical changes. The natural drop in testosterone muscle mass decreases a bit.
Which leads to?
Well, often larger waistlines, losing some of that definition you might have had when you were younger. It's just, part of the process for many guys.
Yeah, it feels like your body isn't quite cooperating with wanting to look good, feel good, have great sex, all that stuff.
Precisely. And what this chapter really clarifies is that plastic surgery isn't like the first thing you jump to. It's not a replacement for eating well or exercising.
Right. It's not a magic bullet.
Not at all. Think of it more as an adjunct. Something that can help tackle those really stubborn spots that just don't respond no matter how clean you eat or how hard you train.
Okay, that makes sense. So for the guys who do go down this road, what are they actually looking for? What are the most common procedures? The chapter gives us some stats, right?
Yep.
From 2019.
It does, yeah, from the Aesthetic Society report. The numbers for 2019, they show a pretty clear picture. Top of the list by a pretty wide margin was liposuction. About 32,800 procedures.
Still number one then.
Yep. Then after that, male chest reduction, for gynecomastia, that was second, around 21,400.
Still a significant number, even if the source mentioned it dipped slightly from the year before.
Oh, absolutely. Still very common. Third was eyelid surgery. That one saw a bit of an increase, actually, up to 18,750 procedures.
Interesting.
And then rounding out the top four were tummy tucks at about 5,830. Also saw a pretty big percentage jump, suggesting it's becoming more popular for men.
So liposuction holding strong, eyelid surgery climbing, tummy tucks climbing, chest reduction, still very common.
Exactly. Now, we should keep it in perspective. Aesthetic procedures are still, overwhelmingly chosen by women. They were about 93% of the total back in 2019.
So men accounted for about 7%. But the trend is the key thing here, isn't it? What the chapter points out.
Yes, the trend is really the story. Over the 5 years before that report, there was a consistent rise in men seeking these kinds of procedures. It's part of this whole idea people are calling the daddy do-over.
The daddy do-over,
yeah.
Like the male version of the mommy makeover.
Exactly like that. It really captures this growing trend of men wanting to address the physical changes that come with, aging, lifestyle, maybe fatherhood itself.
That term really nails it. Men deciding, hey, I want to tackle these changes too.
Precisely. And, while those are the top four, the chapter does mention other things men seek out, like facelifts, hair transplants, just maybe not quite in the same numbers.
And the why behind it all, as we touched on, it links back to those midlife shifts.
Yeah.
The chapter talks about wanting to look maybe less tired or less old in the boardroom, so to speak.
Right. The professional image.
And also wanting to feel younger, more confident physically, the bedroom aspect.
Yeah.
It's about getting your appearance to match how you actually feel inside or how you want to feel.
Yeah, closing that gap between how you look and your internal sense of energy or vitality.
Okay, so let's maybe break down some of these specific procedures.
Yeah.
Starting with the big one, liposuction. What's its main job?
So liposuction is really designed to remove specific targeted pockets of fat, the kind that just sticks around despite diet and exercise. And the chapter says for men, the number one requested spot, the flanks, the love handles.
The classic trouble zone for a lot of guys as they age. Why there specifically? Why not hips and thighs, like often for women?
It seems linked to hormones, especially that natural decrease in testosterone over time, plus maybe lifestyle factors like less time to exercise. Men just tend to store fat more in the upper body, the abdomen, the flanks. Women tend to store it lower down.
That makes biological sense. Okay, so how does it actually work? What's the process?
Well, typically they start by injecting a special fluid into the area. It's usually a mix of saline, which helps loosen up the fat, lidocaine, that's for numbing, and epinephrine, which helps shrink blood vessels to minimize bruising.
Okay, it's sort of preparing the area.
Exactly. Then they use a thin tube. It's called a cannula. The chapter described it as being about the size of a small straw.
Right.
That's inserted through tiny incisions. And using suction, the surgeon basically removes the excess fat while kind of sculpting the area. The aim is often to get back that narrower waistline, that more traditionally masculine shape.
Are there different types, different technologies involved?
Yeah, the chapter mentions a few variations. There's ultrasound-assisted lipo. Vaser is a common brand name. It uses ultrasound to sort of liquefy the fat first.
Makes it easier to remove.
Seems to be the idea. Then there's laser-assisted, like smart lipo, which uses laser energy to melt the fat. And then there's something different called CoolSculpting. That's not actually surgery, it's non-surgical. It uses freezing tech to kill fat cells in smaller spots.
Okay, cool sculpting. Does the chapter mention any, like, warnings or things to know about that one?
Yes, there's an important caution. It's not right for everybody. The chapter specifically warns that if you have a lot of loose skin, using CoolSculpting might actually make future surgery, like traditional lipo or a tummy tuck, more difficult down the line.
So patient selection is really key there.
Definitely.
And I'm guessing the chapter really hammers home that liposuction is not a weight loss method.
Oh, absolutely. That's probably the most critical takeaway about lipo. The chapter is very clear. It should never be used as a way to lose significant weight. Its real value is in refining and contouring those specific stubborn areas after you've already got a healthy lifestyle baseline.
It's about shaping, not shrinking overall, tackling those last annoying bits.
Exactly. It enhances the results you've worked hard for through diet and exercise, helping achieve that more defined masculine look.
Okay, good. Let's shift gears then to the second most popular, male chest reduction. Gynecomastia surgery. What actually causes that condition?
So gynecomastia, it's basically an abnormal enlargement of the male chest tissue. The root cause is often a hormone imbalance, usually too much estrogen compared to testosterone, or sometimes it's just genetics.
We all have some breast tissue and fat there, right? It's just the balance.
Precisely. Men naturally have very little actual glandular or breast tissue, but genetics can mean some guys just start with more glandular tissue or more fat predisposition in that area.
What else contributes besides genes?
Well, apart from genetics and puberty, it's actually pretty common during puberty and often sorts itself out. Other factors can include general hormone issues, using things like anabolic steroids, even marijuana use is mentioned. And of course, overall weight gain and just aging.
Age again? Seems to be a common thread.
It really is. The chapter goes into quite a bit of detail, mentioning certain medical conditions, even tumors, or a surprisingly long list of medications that can mess with hormones, either increasing estrogen or lowering testosterone.
What kind of medications are we talking about?
Things used to treat enlarged prostate, prostate cancer, some heart conditions, anxiety, depression, even some heartburn meds.
Wow, that's a broader list than you might think.
It is. And the chapter also points to other substances, outside of prescribed meds. Anabolic steroids, obviously, but also things like heroin, methadone, methamphetamines, even heavy alcohol use. These can cause gynecomastia and, worryingly, testicular shrinkage, too.
Oof, okay. So how do age and weight play into it more generally?
Well, as we get older, hormone levels shift naturally, and skin loses some elasticity. If you combine that with gaining weight, the chest is just one area where fat tends to accumulate. So in older guys, or those who are overweight, it just becomes more noticeable because of those underlying changes in skin and hormones.
So if a guy is worried about this, what's the first step according to the chapter? What's the advice?
The first step is always talk to your regular doctor. They can help figure out potential causes, look at your medications, discuss lifestyle stuff like cutting back on alcohol or drugs if relevant, and definitely talk about weight loss. Sometimes just addressing an underlying medical issue or changing medication can make a difference.
Okay. And if those things don't work?
Then yeah, a consultation with a board-certified plastic surgeon could be the next logical step to talk about surgical options. The right surgery really depends on what's causing the fullness. Is it mostly fat? Is it dense glandular tissue? Is there loose skin? Or often it's a mix.
And what are the surgical approaches based on that?
Well, if it's mainly fat and the skin quality is decent, liposuction alone might do the trick, much like treating love handles. But if there's a lot of that firm, fibrous glandular tissue, lipo doesn't work so well on that. That tissue usually needs to be surgically cut out.
How do they remove the glandular tissue? And what about scars?
It depends on how much needs to come out. For milder cases, they can sometimes make a small cut right around the edge of the areola, the darker part around the nipple. That lets them remove the tissue, and the scar tends to hide really well there, almost invisible later.
Okay.
For more significant amounts of tissue, they might need an incision in the natural crease under the chest. And if there's a lot of loose skin, especially after someone's lost a massive amount of weight, they might need to remove both tissue and skin to get a flat result.
Removing skin sounds like it might leave a more obvious scar.
It can, yeah.
Hmm.
The chapter acknowledges that removing a lot of skin can result in a more visible scar, sometimes running across the chest. But it also makes a really interesting psychological point.
Which is,
That in the surgeon's experience, many men who've felt self-conscious about their chest for years, maybe hiding it at the beach or gym, they often much prefer having a scar that will fade over time if it means they finally have a flat chest and don't have to feel embarrassed anymore.
that makes a lot of sense. The trade-off is worth it for the confidence boost. What about recovery for this type of surgery?
Generally, it's anywhere from just a few days for simpler cases, maybe up to several weeks for the more extensive procedures, depending on exactly what was done and how active the patient is afterward.
Gotcha. Okay, let's pivot now to the face. Eyelid surgery, blepharoplasty. The chapter says this is super popular for men, maybe even the top surgical facial procedure. Why the eyes?
Well, the eyes are just one of those areas that really show age first, and it can change how people perceive you. Over
Yeah.
time, that upper eyelid skin can stretch and start to sag, giving that hooded look.
Yeah.
Plus, sometimes the forehead drops a bit, which makes the extra eyelid skin look even more prominent. And then on the lower lids, those little fat pads that cushion the eye can start to bulge forward. That's what creates those classic bags.
And the dark circles often come with that.
Exactly. Because as the fat bulges, and maybe the cheek fat below drops a little, it creates a shadow underneath, which we see as dark circles.
It's that look that makes people say, wow, you look tired or need a vacation.
Yeah.
Even if you feel totally fine, your face just isn't reflecting your energy.
That's it precisely. So men often seek this out because they want to look more refreshed, more alert, younger. It could be for personal reasons or, like the chapter mentions, sometimes it's about feeling competitive in the job market, especially if you're up against younger folks.
And things like Botox or fillers, they can help a bit, but they don't fix the underlying skin or fat issues. That's where surgery comes in.
Yeah, exactly. Injectables are great for smoothing wrinkles or adding a bit of volume back, kind of slowing things down, but they can't remove significant excess skin or get rid of those bulging fat pads. That's what blepharoplasty, the surgery, is designed for.
So how does the upper eyelid surgery work?
For the uppers, the main thing is removing that extra droopy skin. The real skill is placing the incision right in the natural crease of the eyelid. When it heals, the scar is practically invisible. Sometimes they might also remove a tiny bit of fat, usually near the inner corner by the nose, just to refine the contour.
And the chapter mentions something about eyebrow lifts in men.
Yeah, it notes that brow lifts are generally less common for men compared to women, mainly because lifting the brow too much can sometimes create a more surprised or even slightly feminized look, which isn't usually the goal for male patients.
Good point. Okay, what about the lower lids? Tackling those bags.
Right. Lower lid surgery is all about addressing those bulging fat pads and the hollows or dark circles they create. There are two main ways to do it, according to the chapter. One is the transconjunctival approach. Sounds fancy, but it just means the incision is made inside the lower eyelid on the pink part.
So no visible scar.
Correct. This works well if the main problem is just the fat bulging out, and you don't need skin removed. The other way is the subciliary approach. Here, the incision is made right below the lower eyelashes.
Okay.
This lets the surgeon not only deal with the fat, maybe removing some, maybe repositioning it to fill the hollow, but also remove a bit of excess skin if needed and tighten things up. It's actually pretty common for guys to get both upper and lower lids done together for a full rejuvenation around the eyes.
Makes sense to do it all at once if you need both. What's recovery like for eyelid stuff?
It's generally not too bad for just upper lids or the inside the lid lower approach. You're usually looking at maybe a few days of feeling a bit sore with some swelling and bruising. The lower lid surgery done from under the lashes, because it's a bit more involved, might add several more days to that recovery time.
It's pretty amazing how these targeted tweaks can make such a difference. It kind of reminds me of that funny Groucho Marx quote the chapter threw in. What was it? She got her looks from her father. He's a plastic surgeon.
Yeah, light chuckle, classic. And it's a good reminder, right? While surgery can do amazing things, especially on the face, The goal for most people, and definitely for most surgeons, is to look natural and refreshed, not like you've obviously had work done.
Right.
And that's where the surgeon's skill and experience really matter, especially, as the chapter points out, finding someone who understands male facial structure to avoid making things look unnatural or feminized. Subtle differences in technique are key.
Absolutely critical for facial work. Okay, let's shift back to the body for a bit. Tummy tucks. The chapter says they're getting more popular for men, though still more common for women. What's the main reason men are getting them?
Yeah, the motivation for men is usually quite different. For women, it's often about repairing stretched skin and muscles after pregnancy. For men, the chapter says it's overwhelmingly about dealing with excess loose abdominal skin after significant weight loss.
So you do all the hard work, drop maybe 30, 50 pounds or more,
hmm
which is fantastic. But then you're left with this hanging skin.
Exactly. And that loose skin can be really frustrating. It kind of takes away from the achievement of losing the weight, makes clothes fit weirdly, can interfere with exercise, and just makes people self-conscious.
The chapter also brought up something specific about the pubic area.
Yes, that's another key point for men. The mons area, that fatty pad right above the penis, can get larger with age or weight gain. And sometimes this can make the penis look shorter or kind of buried.
Right, I see.
So a tummy tuck procedure usually includes lifting and tightening that pubic area as well as part of reshaping the whole abdomen. And the chapter notes this often leads to not just a better appearance, but also improved self-esteem and frequently a boost in, well, their sex life.
That's a really significant benefit you might not immediately think about.
It can be, but there's a big however the chapter includes about who's a good candidate.
What's the catch?
Well, it's not for everyone. If a man is still quite overweight, or more specifically, if he has a lot of visceral fat, that's the deep fat around the organs, the really unhealthy stuff that has to be addressed first with diet and exercise.
Okay.
No surgery, not lipo, not a tummy tuck, can safely remove that internal visceral fat. So the chapter stresses that the plastic surgeon has to evaluate that during the consult to see if surgery is even appropriate yet.
That's super important to understand. It tackles the skin, not the internal fat. Okay, so those are the big ones. Did the chapter mention any other procedures men might consider?
Yeah, it briefly lists a few others. Neck lifts, which have a quicker recovery than a full facelift. Rhinoplasty, which is nose reshaping. Ear surgery, maybe for prominent ears. Chin augmentation, and even lower body lifts for guys who've lost massive amounts of weight and have loose skin on thighs or arms.
Facelifts seem way less common for men, though, based on those earlier stats.
They are, yeah. The ratio was something like 13 women for every one man having a facelift. Part of the challenge for men, especially if they have short hair or are balding, is hiding the scars, which typically run around the ears. It's just harder to camouflage compared to women with longer hair.
And you mentioned this before, but it seems extra important for facial work on men finding the right surgeon.
Absolutely crucial. The chapter really emphasizes finding someone experienced specifically in male facial rejuvenation. Men's skin is different, the underlying structures are different, and the aesthetic goals are different. You need techniques that maintain a natural masculine look and avoid those feminizing pitfalls.
Okay. What about guys who aren't quite ready for surgery, or maybe younger guys? Any non-surgical options mentioned?
Yes, definitely. The chapter talks about injectables. You've got the neurotoxins, Botox, Dysport, Jeuveau are mentioned, which relax muscles to smooth out wrinkles like frown lines or crow's feet.
Right.
And then there are fillers, a whole range like Juvederm, Voluma, Restylane, Radiesse, Sculptra, which are used to add volume back, fill deeper lines, or even subtly sculpt areas like the jawline or cheeks. These can be really effective for specific issues without needing surgery.
Good to know those options exist too. Now, if surgery's on the table, scars are unavoidable. Does the chapter give advice on how to make them less noticeable?
It does. Acknowledging that scars are part of the deal, it gives some solid research-backed tips for minimizing their appearance. Strict sun protection on the scar as vital UV rays make scars darker and more obvious.
Okay, sunscreen is key.
Definitely. Also, massage can help soften scars over time. And then there are topical treatments. The main thing highlighted is silicone. Using silicone sheets, strips, or even gels and ointments that dry into a thin layer over the scar. Studies showed this significantly helps scars fade and become less noticeable.
That's really practical advice. Silicone for scars.
Right.
Okay, so with all these options, the big question is, how do you find the right surgeon? It sounds like a lot of people offer cosmetic procedures.
Yeah, the chapter puts that number out there, potentially over 60,000 physicians in the US doing some form of cosmetic surgery. They might come from dermatology, ENT, ophthalmology, oral surgery, lots of different backgrounds.
Oh, 60,000. That's a huge number to sift through.
It really is, but then it draws a contrast. The number of actual board-certified plastic and reconstructive surgeons is much smaller, only around 7,000.
And that board certification signifies specific, extensive training in this field.
Yes, exactly. It means they've gone through rigorous training, focused specifically on both reconstructive, like after accidents or cancer, and aesthetic surgery, and they follow a strict ethical code. The chapter mentions most of these belong to the American Society of Plastic Surgeons, and a smaller group, about 2,600, are in the Aesthetic Society, which is even more focused on cosmetic surgery education and research.
Does the chapter say you have to go to one of those board-certified plastic surgeons?
It doesn't explicitly say it's the only way, but it strongly advises that no matter who you're considering, even if they have a different board certification, you need to ask very specific questions.
Like what?
Ask about their training for the specific procedure you want. Ask how many they've done. Crucially, ask about their experience doing that surgery on men. You really need to do your homework on their background related to your specific needs.
That's really sound advice. Due diligence is key.
Okay, so as we start to wrap this up, let's loop back to that term we heard earlier, the daddy do-over. Right, it really encapsulates the whole theme. Just like the mommy makeover bundles procedures for women after childbirth, the daddy do-over is becoming the shorthand for men seeking aesthetic surgery to counteract the effects of aging, maybe weight changes, just the wear and tear of life. It reflects that trend we talked about.
And all those motivations we discussed, wanting to look better, feel more confident, stay competitive professionally, maybe improve intimacy, they all feed into this growing trend. It's men being more proactive about aligning how they look with how they feel.
Yeah, it definitely signals a shift, maybe, in how aesthetics fit into male well-being and self-image in the 21st century.
Well, this has been a really fascinating deep dive into Chapter 57 of the 21st Century Man. We've covered a lot of ground: the top procedures for men, why they seek them, how they work, tips for recovery and scar care, and importantly, how to find a qualified surgeon.
And we've seen how these procedures, when used appropriately as an adjunct to healthy living, not a replacement, can really target those specific problem areas and make a difference, not just in appearance, but in confidence and overall quality of life.
The 21st Century Man clearly offers so many valuable perspectives on different aspects of modern life for men, like these aesthetic options. We definitely encourage you, the listener, to check out the book itself for even more detail.
Absolutely. There's a wealth of information in there.
So as we finish this deep dive, here's a little something to chew on, kind of building on that idea that how you look doesn't always match how you feel. With these procedures becoming more common and accepted, how might this evolving landscape of male aesthetics be subtly reshaping our traditional notions of masculinity and self-care here in the 21st century? Something to think about as these options become, well, more mainstream.
That's a great question to ponder.
Definitely join us next time for another deep dive into the 21st Century Man. We'll be moving on to Chapter 58, Medical Fat Reduction.
Looking forward to getting into that one.
Thanks for tuning in to this deep dive.